We at AACC have heard from many members of the public who are wondering if they should get tested for COVID-19, even if they don't have any symptoms and are unsure whether or not they've been exposed. If you're in this situation, you don't need to get tested yet, but definitely consider self-isolating for 14 days if you are at all worried that you might have come in contact with the virus. You should also diligently monitor yourself for COVID-19 symptoms during this time. These include fever like chills and or sweating, cough, mild or moderate difficulty breathing, sore throat, muscle aches or body aches, vomiting or diarrhea, and new loss of taste or smell. If you don't develop symptoms by the end of 14 days, good news, you don't need a test. If you do develop symptoms, the next step is to contact your healthcare provider about getting tested, just like you would if you were to get tested for strep throat or flu. Even if you're only experiencing mild symptoms, it is especially important to ask your provider about getting tested if you're a member of or in extensive contact with vulnerable populations, such as the elderly or residents of a group living setting. However, do be aware that if you have mild symptoms and are not a member of or in contact with a vulnerable population, your provider might advise against testing if there is high demand for tests in your area and the local labs need to focus on high-risk cases. Don't worry if this happens. Most people who have mild COVID-19 symptoms can recover at home without medical care. It is still important to self-isolate until you've recovered though, and to be sure to let your provider know if your symptoms get worse. I also want to add, if you are in close contact with someone who has been diagnosed with COVID-19, this is the one time when you should ask your provider about testing, even if you're not showing symptoms. This is because prompt testing for close contact of COVID-19 patients is critical to preventing symptomatic and pre-symptomatic disease transmission.